The thing you dislike the most?
I guess I didn't anticipate it, to have so much nausea. I mean, I just had a major surgery not too long ago and came out of it nauseous for a day or so, but not as bad as, you know, every time I get up or sit down. But I get it, it's the changing of my body, you know, the things that are happening to it. I'm not a person that burps. I never have. I burp more in 3 days, and it helps, but that's not me. I didn't grow up that way, you know. You kind of suppress those things. But it's helped a lot. But yeah, the nauseous is just one thing that I didn't anticipate. I don't do good with it because I get car sick. I mean, I get car sick going from the hotel here the first day. So just adding that nauseous on top of it. But
now the interesting thing is that you have a predisposition to nausea. What we've been seeing is that because of the way we pre-medicate, and then I don't know if you guys checked it out, but we have 2 anesthesiologists on top of you doing the work instead of 1. So we're very proud of the anesthesia process we do. It's very quick, and as soon as you're out, you're back. That was the impressive part. So we control nausea very differently than what we see in other hospitals and other practices. And it's interesting that you would say that you have predisposition to nausea, because part of it is then going to be the predisposition, and part of it is that the burping is just the mechanics of your stomach saying, wait a minute, there's too much air in here. We got to remove it, because it has a much smaller pouch, around 50 milliliters, so it's a pretty small pouch now.
yeah, I mean, I don't feel, I get the part of getting over it. It's just having it, you know.
Well,
I foresee better days, but
yeah, something that can help you seeing yourself at your weight loss goal, or seeing you right in her shoes, 80 pounds less.
oh, definitely. I already have life changes in mind, but I'm one of those people. I've already walked and been. I do the gym. I do it. You know, I walk 25 miles a week.
Oh,
so it's not going to be anything new. It's just going to be the extra now, adding to it.
The tool that's going to help you get to your
Correct.
weight loss goal. Very cool.
My name's Mike Russell. I'm from Virginia. I did a lot of leg work on the surgery procedures for myself for about 6 months now. I originally started off wanting the lap band procedure. I'd gone through the entire process. I'm hoarse and I apologize. I had surgery yesterday. But I went through the entire process, had surgery scheduled, and a gentleman walked in Northern Virginia and was carrying on a discussion that his daughter and his daughter-in-law had a procedure done here in Tijuana. And we were just discussing, he was a diabetic, his insurance was covering it, my insurance wouldn't cover the procedure. He said, well, you'd be crazy not to go there. He said the facilities are immaculate, and he said the nursing staff's great, which that's an understatement. It's well above exceeded expectations, or what I was told. So that afternoon on the drive back to our home, I told my wife that to cancel everything, that we're going to go to Tijuana to get it done. Of course, she said I was crazy. I've got a lot of friends and family that up to yesterday before I walked into surgery were sending texts saying, no, don't do it. So it's kind of funny, but sitting here in the lobby is really a good source of information for people. And yesterday I found out about the gastric plication process. I didn't want to do the sleeve as some of these ladies had because it was such a permanent and such a drastic change. So I was scheduled for the band. So about 15 minutes before we went into surgery, I threw it on Dr. Ortiz that I wanted to change the process. It was very helpful. He sat down and explained a few things to me, which a lot was covered in the sleeve. It's a very similar process, and explained to me how they roll the stomach and put sutures in. So at that point, you know, I obviously consulted with my wife and made a decision. That's definitely the route I wanted to go. I had surgery yesterday afternoon. I guess I got a little rowdy in the operating room coming down. I was asked if I was an MMA fighter, so when I came out, I gave him a hard time. But everything went great. I woke up, I've been walking. I've tried fluids today, everything's fine. I really don't have a lot of negatives to say at all. I guess one thing, being at the age of computers, I would like to have seen more of this forum where you can actually put faces to a patient versus, there's so many misconceptions and misleading things out there. Anybody can put an article in, I've had a great time, my car runs great, and you go to look at it and there's no tires on it. But if you can actually see faces that you'll be able to see now that Dr. Ortiz is doing this, I think it's going to be very helpful. And it definitely, I would have had a different comfort level coming, if I could have seen that. So, but the process has been great. The other people getting the procedures have been great, and the nursing staff second to none. The states could actually learn from the nurses here. Most of the time when you go to the hospital in the States, it's a burden. They make very good money, but it's a burden for you to be there in the hospital. You don't get that at all here. Everybody is very nice. They go above and beyond. The gastric band versus the sleeve, I didn't want something permanent. And for my knowledge, Dr. Ortiz and them doesn't have a lot of slippage, but I've heard of slippage through a couple different places, like the one I was in Northern Virginia. That doctor didn't have a lot of slippages, but he had patients that had come in and had to perform somewhere else and had slippages, and I believe one of the nurses here had a process done somewhere else and had some issues with it too. So it's just a matter of making choices. And Dr. Ortiz, you may laugh, but I actually, when I sit down to meet with him, I said, I want your opinion on what you would do. So, I'm in the construction business, and that's why I tell everybody I build my house the way I would build your house, or build your house the way I would build mine. And I'm very frank and give them my opinion on things. And I've never had a doctor give me an opinion of the three. Well, he told me the decision I was making is probably the one he would make. So I felt very comfortable at that process, at that point in the process. But they took the IV out literally 5 minutes ago so I could come out here and sit for the interview. But I feel great. The fluids are going down fine. I did notice a little bit of nausea myself, but actually what I'd done is they gave me a juice pouch and I drank just a little bit too much of it. And it wasn't that I was going, it just wasn't, I didn't put it in a teaspoon. I just took a drink and I actually went in and just spit a couple times and it went away. But, very quickly realizing what the portions are going to do. But I feel great. And one thing I probably should point out, and Dr. Ortiz didn't elaborate with you guys on, when he operated on me, when I went in to do this process, my BMI is low. It was 38.5. In the States, you have to have at least 40 to get it done. When he went into the process, he said he had to cut 5 pounds of fat out of the way before he could even do the process. All my weight is sitting right, which most men get is right there. And I had a lot of people tell me I didn't need the process, I didn't need a procedure, it's wasting my money. Dr. Ortiz told me within 2 years I'd be a full-blown diabetic with a lot of health issues if I hadn't had this done. I firmly believe him too. I could tell in the last 6 months the health issues of being more tired. I've got an 11-year-old son that I play basketball with and everything. For the last couple of years I've gained so much weight, don't swim, anything, and I want to get my life back. So that's the reason I'm doing this process. But thank everybody involved. They're very nice.
Well, I want to thank you all for your sincerity, for sharing your story. We really don't care where people get help. What we want them is to get good qualified help, and we want them to find good resources. This is the reason why OCC TV is dedicated to 100% to educating the patient on weight loss surgery and the life that comes after it. So I want to thank all the viewers again for joining us, viewing OCC TV. This is the Obesity Control Center, an international center of excellence. I'm Dr. Ortiz.